all of you who were able to dial in. We apologize for the technical difficulties we're having with WebEx. We will be sending out the recording to all registrants so that you can actually see the webinar in its entirety with the video. So I am Kelly McDevitt. I'm the president of IBI and mightily embarrassed that we can't get WebEx to work this morning, but everyone will be able to view the webinar in their own time. So I'm glad we have the capability to record it and get it out to you all. So for those of you who don't know IBI, we are a nonprofit education, research, and analytics company that really concentrates in the space on linking productivity and workforce health. We have the largest benchmarking database in the United States that benchmarks STD, LTD, workers' comp, and FMLA claims. We also have a research division, which we are presenting today. We do true academic, rigorous research on our team, and we ask our membership each year what type of topics you all would like researched. And as you can imagine, when we asked this last year, the top topic in our discussion was mental health and behavioral health. Obviously, this is an issue that we have all faced over the last 18 months in the United States. It was an issue that we were all facing as employers and employees before the pandemic. And as you all know, the pandemic just exacerbated many existing issues that we are already facing with access, quality of care, and the like. A little bit about my personal story and why I was extremely interested in doing this type of research is that this particular topic hit my family directly with my son. I have a 17-year-old, now 18-year-old, who a year ago today was actually sitting in a pediatric emergency room for 4 days, doubled up in beds here in Charlotte, North Carolina, awaiting a psychiatric bed. And so while I had for 35 years helped my large employer friends square away some of these issues for their own employees, I had never been faced with it personally. And so a year ago today started our journey through the broken mental health system. And what I learned was that those of us who are fortunate enough to have many friends in the business to help them navigate, it is still an issue, trying to find good care at the right time for the right person and the right course of treatment. And so as I'm on this journey with my son, and he is still on his journey, I'm learning more and more about where the gaps are for our employees who are out there, especially in this environment where some are remote and some are in the office, are out there on their own trying to find resources and products and programs to support themselves and their families. And so we thought it was extremely important that we do this research to show, where we are in the United States right now with this topic, and more importantly, how employers can really support their workforce and help them be more productive, keep them at work in their seats, have them be present while they are at work, and quite frankly, to have support so that you can attract and retain your employees and keep them in your workforce. So without further ado, we will have our lead researcher, Dr. Nicole Nicksic, talk about the actual research that we did, where we got the data that we used, and what our findings were. So I will turn it over to Nikki.
Great. Thank you, Kelly. As Kelly shared with you guys, we have our research priority projects every year, and this happens to be the one that comes on top and is a topic that's near and dear to all of us. And we're happy to do this research and share it with you guys and have a great panelist discussion at the end. So just a short agenda of what I'm going to go through on the research side of things, a little bit more into the background and the research questions we identified, the data and sample very briefly, and then really going over our main findings leading into the employer guidance that we've done, and then allowing you guys to enjoy the employer panel that we have today. So we know that mental health was challenging. It was an issue even before the pandemic started. We know there's issues with stigma, again, with access, as Kelly had mentioned. And we know that COVID-19 has had even greater effect on mental health and productivity of the workforce. And mental health, we know in prior studies, is related to absenteeism, presenteeisms, coming to work sick. And amongst all adults, the CDC reported a threefold increase in depression and anxiety from before the pandemic. So looking from 10.8% of all adults in 2019 to 33.9% in just April of 2020. So we really wanted to look specifically how, COVID-19 affected the mental health of workers, considering all these different sorts of work disruptions and work environments changing and children home from school and things like that I'll talk about have really affected how people have been working throughout the pandemic. And then we have this employer guidance section that I'll briefly touch on that's more in the report that we have released about a month ago now, and the panel to talk about how they've experienced it with their own employers. So the research questions that we look specifically at are how these work disruptions affect mental health. When by work disruptions, I'm specifically talking about being on leave, working from home, doing telework now, due directly from the pandemic, and then having children that are home from when schools were closed. And then really kind of wanted to look at demographic differences. It's something that came up often and something we were interested in and how that affects different demographic groups. And then we're able to measure some healthcare needs. If people delayed or skipped medical care, we know that's been an issue. Looking at counseling needs and if you were able to receive that or not, and then having a mental health prescription and how did that affect this relationship as well. So when I talk about anxiety and depression, there's different ways to measure that. The specific data set that we did use had a 2-question screener for each. So just to show that the patient health questionnaire for depression asks 2 questions about interest or pleasure, and if you're feeling down or depressed in the past 7 days. For generalized anxiety disorder, we're looking at feeling nervous or anxious, not being able to stop or control your worrying. And so essentially having either one of these symptoms for most days in the past 7 days identified you as having symptoms of anxiety or depression disorder. So we kind of look at that as a yes or no throughout. Just real quickly on the sample that we used, it's the household pulse survey that's collected by the US Census Bureau, really kind of focusing on like the financial impact of COVID-19 on US households, but had some work-related questions and obviously looked at anxiety and depression. And they collected ongoing weekly throughout 2020 into 2021. They're still collecting information now, and so we're able to have a little bit more of a real-time sample for this to look at. And of course, we're looking at adults that were under 65 that had worked or on a potential temporary reason of leave in the past 7 days. And we looked at this overall in models from April 23rd of 2020 all the way through the end of March of 2021. So main summary of findings, one thing to take away from what I had found, and not surprisingly, is that anxiety and depression have skyrocketed for employees specifically during the pandemic, even more than just adults in general. And when we're looking at differences for employees that are worse off than the national average that I'll introduce, we're looking at see that there are differences in regional areas. Also those that were, put into telework positions due to the pandemic, those that had to take leave, those that were female, younger, less educated, white or another race, and not married. And then we're looking at those that did not meet all of their health counseling needs or were taking a mental health prescription. And I'll jump more into these. So before the pandemic, specifically for employees, we're looking at 8.7%. And then across this whole time frame from the end of April of 2020, or end of April 2020 through end of March 2021, we're looking at 39.5%. So 4-time increase for employees compared to 3 times for just all adults within the US. We look at different states compared to this national average. We're seeing a lot of increases in western states, Nevada, Oregon, and southern states like Oklahoma and Louisiana. It's just a map to kind of show differences here. And then when we're looking at these work disruptions, we're seeing that those that experience them were experiencing more anxiety or depression, not surprisingly. So those that had to take leave compared to those that were currently working, those that had kids home from closed schools compared to those that kids were able to continue their routine and go to school. And then also those that had changed to telework within the household compared to those that were teleworking prior or had to continue to work in person. And again, those differences, just kind of looking at the different numbers, I know there's a lot of numbers here, but we're definitely seeing these differences in females versus males. And we know that from previous studies, anxiety or depression is reportedly higher in females as well. We're seeing this trend as you age, your anxiety or depression decreases. Also in white or those that identify as other multiracial, we're seeing a higher report in anxiety or depression, and also in those that were not married at the time, also at higher.
Nikki,
Yes.
just to interrupt for one quick second, housekeeping. For those of you dialed in, please check your email. We are sending you a copy of the deck right now so that you can follow along. And Nikki, if you could just kind of give them an idea of what slide you're on as you change slides. Thank you.
Yes. Great idea. Thanks, Kelly. So now I'm looking at the slide that's looking at these overall differences between women and men. This was something of interest to our mental health experts that joined our research group and really kind of wanted to dig in this with the fear of more women turning over in the workforce due to the pandemic. So to note, both women and men reported more anxiety or depression when they had a work disruption, such as changing to telework or having kids home from school, yet it was always higher in women across the board. And when we combine looking at telework and having children at home, we're seeing a significant increase for women at 46% reporting anxiety depression compared to 38% for men. So both high, but women were really experiencing this impact at higher rate. So we're kind of looking at these different healthcare aspects, really interested in counseling needs because we're able to ask if they had received counseling and if they needed counseling but were not able to get it. So what we're seeing here is that those with unmet counseling needs are worse off regardless. So even if you did receive some of your counseling sessions, if you weren't able to get everything that you needed, you're going to be worse off than those that were receiving counseling or claiming they didn't need it. Not surprising. Also, we know that if you're taking a mental health prescription, you're more likely to report anxiety or depression. Also not surprising. But we're seeing in these categories with counseling needs at the bottom here, even if you were receiving a prescription, it's not going to mitigate those differences with counseling. So some importance to that. So what I did based off of that was seeing if these work disruptions were affecting the way are people getting counseling or not in this next slide. With the bar charts on counseling needs, looking at these work disruptions directly. So knowing that if you're receiving counseling, it's going to reduce your anxiety or depression based off of these work disruptions if you're getting the counseling that you need. But to note that regardless of where you were with your counseling needs, being on leave was worse off in any category. So something, to kind of note for building benefits and looking at people that are taking leave and why they're taking leave and being able to support them when they are. And then also, even when your counseling needs are fully met, when you have those work disruptions, when you've been changed to telework, when you have kids at home at school, you're still going to see more anxiety or depression there when you do not have these work disruptions. So just kind of wrap that all up. We asked and sent out to our employer pool of 1,400 employers and kind of asked them how they're measuring mental health status, what they're doing to improve mental health within their company, and different strategies that they've used to measure impact and with productivity and wellness as well. So it goes more in depth in the research that we wrote up for this. But just to kind of touch on these just a little bit, we're seeing that people were using claims and people that were using EAP utilization, so getting counts on that, using employee surveys and screener surveys to kind of get an idea of how people were holding up with mental health. And then different strategies, I mean, these just varied across everyone that was able to respond to us. But we're really looking at changing in health plan in your design, and communication came up a lot. So showing the resources that you have, communicating that in different ways to make sure that people know where to access different plans and EAPs. And then when we're looking at measuring impact, there was a lot of report on using claims data again, and also using outcomes data from vendors. And then we asked also about challenges and how they overcame them. Lots of different responses on access, getting employees to be engaged and to participate in things, and also stigma came up. And then being able to effectively communicate. So we touched more on those different topics and what people did to circumvent that. And then just general considerations that people had, anything else to note. And one of the ones that I really liked is that someone had said that there was a silver lining to the pandemic, and it's to use this momentum that we've seen for mental health and to really bring actual change from that. So as I mentioned before, we have a report, executive summary and guidance that goes into these findings and our employer guidance more in depth. That's available on our website. And also we did this nice infographic kind of pointing out these main findings that I went through with today, just a one pager to be able to have all these in one place and be able to share that. And then so now we move to the panel, and I'm going to give it back to Kelly to introduce our panel and kick us off.
Yeah, thank you, Nikki, very much for all the work that you've put into this. And for those of you who would like to see the full report, you can find that on our website. We also have a one-page infographic that Nikki just had up on the screen. That's very helpful to see the summary findings. Obviously, none of these findings were very surprising. As we did the research, I think we all realized where we were and where we sat during the pandemic. And honestly, I think that if anything, we probably all think that these findings are underreported. Certainly, they probably are larger than we even know. So this is just the people who chose to come forward and answer the questions in the survey, obviously. So we are very happy. Obviously, our goal here at IBI is to help employers and their workforce stay productive, understand what the issues are, and to come forward with some really best practices around where do we go from here. So we are very lucky today to have two people who know this subject very well. Lisa Thompson, the Director of Benefits at Grainger, and we have Matt Ponicall, the Senior Vice President of Benefits at Bank of America. So I'll let each of them introduce themselves and say hi to our folks who have dialed in and those who will watch our video later, and then we'll get started on some panel discussion. Matt?
Great. Thanks, Kelly. And thanks for having me and allowing me to attend this session. I'm really excited about it. You know, behavioral health and emotional well-being is a passion of mine and has been since I joined Bank of America, going back 6 years now. And, so my responsibility at the bank, so our benefit strategy is focused on three main pillars: physical well-being, emotional well-being, and financial well-being. My core responsibility sits in the physical well-being space, but that's not to say, as you can all imagine, those three topics are very interconnected. So I work very closely with my peers in the emotional well-being space and financial well-being space. And, the reason we built that strategy out was because we understood the connectivity between the three. And at that point, I think we were far enough along in the physical well-being arena that the focus really had to be on the emotional space. And so we've made, and that was done back in 2017. And this is an issue that predates that and is continuing on today, and I think a focus of a lot of large employers. So excited to be here and talk about the strides that we've made and, quite frankly, the challenges that we still have in this space trying to solve what is a problem that pretty much, I would say, every large employer is trying to solve at this point.
Yeah, couldn't agree more. Lisa?
I'm Lisa Thompson. I'm the Director of Benefits at Grainger. I have been with Grainger just over 2 years. And similarly to Matt, we have actually 4 pillars of well-being. So we look at physical, emotional, financial, as well as social. And my team is responsible for 3 of the 4. It just so happens, obviously, that as part of the pandemic, emotional well-being has become something that it has been at the forefront of our team members' minds as well as our leadership. And so we've really worked to address that in particular over the last 12 to 18 months.
Yeah, so I want to kind of set this stage here. I will say that for me, working with large employers like you all for many, many years, I'd go into a QBR. Matt experienced this firsthand, and we talk about the medical trend and the pharmacy trend, and all the usual players. And when we got to mental health 10 years ago, a lot of employers would kind of skip over it or spend very little time on it. And it wasn't because they didn't care about their employees. It was because it didn't cost them a lot of money, right? So mental health really never drove medical trend because it's cheap. The care is cheap. Not everybody uses it, etc. I think that, as Nikki was talking about, the silver lining of the pandemic was that it got employers to really understand that it wasn't just the mental health claims themselves that were costing them money and having their employees to not feel good about themselves, but that there's productivity implications, there's attraction and retention implications, there's family dynamics. There's so many other things that come with mental health care besides the actual claim. So I want to kind of back up to pre-pandemic. How did you all go about choosing a benefit strategy around emotional well-being? And when did you really realize that this was something that was going to be a long-term problem that you were going to have to solve for? So I'll start with you, Lisa. Pre-pandemic, how did you approach mental health benefits?
Yeah, I would say actually, Kelly, your story about your son really resonated with me. So pre-pandemic, we had a carve-out mental health program for our 3 medical carriers. And the biggest complaint that I received when I joined Grainger is that parents could not find an in-network provider for their child who was experiencing difficulties. So, it wasn't really the claims dollars that drove my decision to look at this. It really wasn't the expense. It wasn't productivity. It was access. So I started looking at the mental health carve out that we offered from an access standpoint. And what we found was that our carve out provider just did not have the right specialist for children. And so that's really what drove my decision. I was able to make the case internally because it was cost neutral to move from the carve out to carving in. But the way I sold it to leadership was the access improved. So instead of getting team members, tearfully contacting me and saying, not only am I dealing with this situation with my child, but I also can't afford to pay for the care. It was a really easy solution for us to carve that into our medical programs and increase access. So that was really the driver for that decision.
And did you find that carve-in approach worked as well from an integration standpoint, where you had all the data in one place and could actually see not only where the behavioral health data was in and of itself, but how it affected the outcomes in the medical data and et cetera,
Yes.
having that integrated?
Yeah, I mean, I think, Grainger had the carve out for, let's say, 20 years and hadn't really thought about where companies are in 2020 or 2021. And it just made sense at that point from a data perspective to also carve it back in so you could more easily see that the claims data together. It's a good point,
Yeah.
Kelly.
Yeah, that makes sense. Matt, how about you guys, before pre-pandemic, and what your strategy was then and why you approached it the way you did?
Sure. So we have not had a carve out for many, many years. We've integrated behavioral health within our 3 national medical carriers, as well as EAP within those carriers versus sort of a broad overlay EAP, because we wanted that coordination, those transitions to occur. But just as what Lisa said, pre-pandemic, and this is not a Grainger issue, it's not a Bank of America issue, this is a United States issue. The lack of access to behavioral health professionals, especially professionals trained to deal with children, and we don't need to go into why I believe that, but was a huge issue. And there was network inefficiency. So trying to get people appropriate care within the network when many behavioral health professionals, quite frankly, didn't need to contract with the medical insurance providers. Their rosters were full. And then the affordability issue was a big deal as well. And so, we had to take a step back and say, okay, how can we solve the access issue? But even more importantly, how can we solve the navigational issue? So I always use the analogy that, from a medical plan perspective, when you get sick, you generally know where you're supposed to go, right? If your child is having behavioral health issues, or you are, it is very difficult to navigate that space. So it wasn't necessarily, and it was never the cost of behavioral health, because we knew the connections between behavioral health issues and medical issues. And you can read the studies, outcomes for specific, diseases or acute episodes. Cancer is a great example, are much worse when someone is dealing with a comorbid condition of depression. So, what we really tried to do was really connect that through and then understand how can we develop a solution that helps people navigate what is a very complex, healthcare is complex in the United States anyway, but when you narrow it down into that component, it becomes even more complex. And so how can we support our teammates and then really start to break down some of the stigmas, which, again, going back 17, 18, still really existed. And, I agree with Nicole. Many of those are geographic distinctions. I think many of those are socioeconomic distinctions, demographic distinctions, and what steps could we take internally to really break down some of those barriers to make sure people knew, I hate to use a cliche, but I think it's an important one to say, it's okay to not be okay. And we've got resources that can help support you in that arena. And it's been a multi-year journey, and I can admit, we've not solved for that at this point. And I think a lot of large employers still struggle with what's the right solution to try to get at the core of the issue.
Yeah. And so that gets exactly to the next question, which is how are employers successful in eliminating, or at least attempting to eliminate, stigma? And we asked that in our research questions of our employers, and many came back and said that they felt like top-down approach was extremely important in the strategy. That if you didn't have leadership support to be able to go out and say, it's okay to not be okay, and you can trust us and tell us, and that we then actually have a program to support you, that no approach, no strategy is going to work. So Lisa, tell me about how you approach that at Grainger, and how you believe you're successful in letting your employees know that they can trust you and you are there to support them.
Sure. So in addition to carving in mental health, we also made a pretty significant change to our EAP program just last month. So again, we had been with the same provider for over 20 years. We, through the pandemic, started to get complaints. So the EAP program that we used was an old model. Called in, you got the name of 6 providers, you had to call them, ask for an appointment, What I started hearing was that appointments were 4 weeks out, 6 weeks out, 8 weeks out. But the even worse part was when our team members actually got to the appointments, the providers didn't even seem to care about them. So, whether it's just the providers being so stressed out by their their increased workload during the pandemic, or whatever it is, we knew that EAP solution that we had was not working for us. So we made a change, and I actually implemented it 10/1 because I didn't want to wait for 1/1. We rebranded our EAP program to a stress management program. We went to a different provider that has a different model where you can get online, you can see the providers, see their availability, and book it, usually within the next 24 to 48 hours. So this was a huge change for Grainger. And the great news was we have senior leadership support. So our CHRO made a video talking about some of the new benefits. Our CFO actually joined one of our BRG meetings with our new EAP provider to really break through the stigma that certain cultures have in accessing therapy. And so what we've seen is that, through the pandemic, our leadership from the CEO, the CHRO, the CFO have really spoken to the need not just to take care of team members' physical health. So not just, stay healthy through the pandemic by wearing your mask or socially distant, but stay healthy by also taking care of your mental health and your family's mental health. So I can't say enough for having that leadership support as we roll out some of these new programs. I checked just before this call, Kelly, because I knew you would want to see some stats. In 9 months with our previous EAP provider, we had about 1,100 people who accessed the EAP program. And in the first 18 days, we had 500 people access the new provider. So, I think the rebranding, the leadership support, really talking about taking care of your emotional health in addition to your physical health, those are the things that have really made this work at Grainger.
That's awesome. Those are pretty impressive numbers, Lisa.
Yeah, I knew you'd want to hear the stats.
Yes, of course I do. That's a pretty good uptick. Let me ask you a question. The new EAP vendor, do they have digital resources as
They
well?
do.
And do you think
They
that really helped to open the floodgates to people who weren't willing to go in person but were willing to do it virtually?
I think so. I mean, I think, given that we're still in COVID times and some people still have hangups with going in person, having the digital solutions is great. We have a really diverse population in that, some folks are non-exempt, have been working in person during the whole pandemic. Some folks have been working from home for almost 2 years. So there's different comfort levels within our population. This new solution can really meet our team members where they are. So they do have, to your point, digital tools for people who are really comfortable with those digital tools. They also have just your standard 800 number for people who aren't as familiar with apps and websites. And if you just need to call, they have a care navigator who can help get you to that right resource. So we've seen it to be very successful. Again, we only launched it just over 30 days ago. So I'm very excited to see what's to come in the coming weeks and months.
That's awesome. So let's move forward on our timeline to, okay, we're locked down. Our poor HR professionals have a new job, and it is finding plexiglass and sanitizer and masks and return to work strategy that they never had to think of before. And you're also realizing that you may have sent people home who, in the old days, you would have put through a very rigorous process before they earned the right to work at home. And now here we are. Where did you, what was the point that you realized that there was going to have to be a new strategy during the pandemic as it relates to emotional well-being. And how did you realize do you have people calling in all of a sudden and saying, I can't cope with this, having the stress of either working at home or being out on the front line for the frontline workers, I need help? Or were you looking at data and other resources to understand that this, steep scale of need was going up very quickly once the lockdowns started happening? Where did you find the data and the information you needed to know that you needed to come up with a new solution or more solutions, as the case may be? Matt, I'll start with you.
Sure. I mean, we actually found that prior to the pandemic, and I'm so happy to hear Lisa's response to the last question, because we did a lot of the same. EAP, Employee Assistance Program, people don't know what that means. It's just not a good name. So we actually changed it to confidential counseling. We also had tremendous support from leadership. For example, we had our CHRO lead what we call a courageous conversation on suicide prevention. Not the softest topic. It actually was the second highest rated, what we call live to desktop or broadcast, behind our CEO's quarterly town hall. So people are anxious to learn more about this, and that really helped us. And we saw our behavioral health utilization skyrocket. Trends were running in the 10 to 15% range, which again, not a big dollar figure, but our big concern was, are people going to the right place to receive care? So we did a number of things. So we knew when we sent home, and just like Grainger, we have a cohort of employees. We still operate 3,400 financial centers across the United States, call centers, operation centers, where people were in the office every day. So they were dealing with a level of stress and anxiety that one could only imagine, as well as those folks that were now working from home, potentially in a situation where they had children learning from home. They had a spouse or a partner who was also working from home. So we made the argument from day one that there's not one person that works for this organization that doesn't have enhanced stress and anxiety, whether it's due to the pandemic or their living circumstances. So we knew it was only going to get worse. So we introduced a number of tactics very early on, one of which was through our virtual care provider. We added behavioral health services through either therapist, psychologist, psychiatrist. We made that completely free of charge. So remove that cost barrier. Give those folks that don't have access to a provider access. We saw tremendous utilization. We introduced and really enhanced things like manager training. And, with manager training, we know that a lot of our teammates are going to their managers with these issues. So get them trained on things like basic resiliency, really thinking across the spectrum of emotional well-being, from everything from stress, resiliency, through major depression, substance abuse. And we knew we were going to see an increase in all of those things across the board. We developed what we had called sort of our coronavirus resources, which sits at the very top of our intranet site. And there is a specific section for emotional wellness. And, leadership from the top of the organization, because look, let's be honest, Matt Ponicall goes out and tells you you need to take care of your emotional well-being. Not a lot of people are probably going to listen, but when senior leaders in the organization do, they will. And so we introduced resiliency apps. We introduced a program through Thrive Global to help people with resiliency, emotional stress. Again, we provided free of charge behavioral health services virtually, and we saw huge upticks in utilization and got a lot of great feedback. And it really is, that leadership support just goes so far to get people to really embrace the fact that they need help, and to provide them with the various resources, and be very thoughtful about how you describe what those resources are and how they can best support your needs, and not just the needs of our teammates. We always say when we talk about physical, emotional, and financial well-being, it's not just the teammates that work at Bank of America, it's their families as well. Because an employee whose spouse, partner, or child is struggling emotionally, that's going to impact their ability to do their job effectively, whether they're in the office or at home. So those were a number of the things that we've done, and we continue to push forward with new programs and evaluate other opportunities to continue to move the needle. And quite frankly, I think we, as probably a lot of employers, benefited from kind of the change in the mindset in the United States. And it may be cliche, but you talk about athletes coming forward and, actors and, famous people, however famous they may be, and talking about their struggles with mental health, that actually does have an impact. So you've really got to be prepared with those suite of programs so they know where to go, because it's okay to ask for that help and try to get that help to resolve those issues.
Yeah, and that leads me to another question that is adjacent. Our next research project is helping employers understand how the products and programs that they just kind of quickly put in the last 18 months are actually working, right? So I've heard from a lot of employers that they didn't feel like they had the time or the resources. As I said, HR folks were a little busy with other things to do their typical due diligence with RFIs and RFPs and things. And so a lot of employers threw, some stuff at employees just to make sure they have the support, some digital resources, apps, et cetera, and to enable them to have somewhere to turn. And when we reach a point where we're a little bit more stable and we're able to look at data, what some employers are asking about is, how am I going to measure success now? First of all, how am I going to even define success? What is success? We used to measure success in these types of products and programs by either ROI, VOI, or engagement, right? That's how we typically always measured success. I'm not sure all those things are still on the table, right? ROI has become less of an issue or a focus. VOI, value on investment, is a huge focus. What are our folks really getting out of this? What are their family members getting out of this? And then really thinking about the sort of halo effect of all these products and programs. Were my folks happier? Were they more productive? Were they less lonely? Were they less isolated? Were they able to perform their job more effectively? Those things aren't found in claims data, or outcomes data that we usually would look at. So thinking about looking back on this time period, this 18 months into 24 months, when we're all a little bit afraid of what the tail end of this is going to look like with all the delayed and avoided care, how are you all as employers going to look back and say, the resiliency training we did for our managers worked. The digital app we put out for mindfulness worked. How are you going to measure that? Lisa, I'll start with you.
Yeah, I think it's hard sometimes to think through how the programs work out. And, typically what I hear is complaints when something doesn't work out. But if something does work out, you don't hear anything. So what's actually been great, I've had a couple employees seek me out, and we put in a new digital musculoskeletal program during the pandemic, and two separate employees reached out and said, hey, were you the one who was responsible for putting out this new program? And so, I took a deep breath and said, yes, sort of waiting to hear what the complaint was going to be. And both of them said, I've been in pain for 5 years, 6 years. My quality of life has been X, Y. I was afraid to go to physical therapy during the pandemic, and suddenly I have my life back. And so, part of our job is always to look at the data, but I think another part is to capture that team member feedback. So one of the things that I'm going to do going into next year is to do a pulse survey of our team members of some of the new programs we've put in, and try and get some feedback from them. Because again, what we typically hear is the complaint, like, my enrollment didn't go well, or my claim wasn't paid, or, whatever that complaint is. What we need to get to are those stories of, and I've already heard some of these on our new stress management provider. Like, I never thought I was the type of person who would get into therapy. But when I found out about this new resource, I tried it, and I think it's going to change my life. Those are the things that we want to hear, to really see how the programs are affecting our team members and their families.
Yeah, and I think that's the struggle. There are many employers, who still struggle with asking ethnicity from their employees. And so how will those types of employers build a trusting enough environment that you can go ask someone, did this help with your isolation, your loneliness, your fear, your anxiety, the uncertainty? Those are questions you don't usually see on a pulse survey, right? So
that's why it will be anonymous.
Yeah.
But I also try to pulse with leaders too. So, one of the things we really heard during the pandemic was that our distribution center team members were under so much stress. So, Kelly, when you talked about all of that equipment, that's the equipment that Grainger's providing to all these companies. So our team members are working overtime and Saturdays for months and months and months at a time. And really, that was another key driver in terms of putting in a new, transforming our EAP program, because I just heard from leaders like, our people are weary. We thought this was going to last for 2 months or 3 months or a year. And here we are, like, coming up on 2 years, and people are just weary. So I think pulsing with leaders to get their feedback on the new programs will be effective also.
Yeah, and what we're looking at in our next research project is, where are some other sources of, you all know your cultures best. There are certain cultures at work where you can ask those questions of your employees and they will absolutely answer you and be honest. And there are others that would never answer those type of questions because they're afraid Big Brother is watching, right? So how can we, like organizations like ours, help employers ask those questions? Are there other forms of data? We've looked at patient-reported outcomes. Typically those questions are asked in a clinical setting, but what we found was people are pretty honest with their doctors about how things are really going. Is there a way to capture that sort of data? Are there new data sets, perhaps that we haven't looked at in a long time, HRQs and HRAs, where you're asking a certain set of questions, people are used to answering them to get their incentive money or whatever the case may be? Are there places where we can fit these questions in and then have access to that data that's outside of the normal, employer pulse survey? Matt, how are you all approaching, measuring value of the products and programs that you've put in?
Yeah, it's one of the toughest things that we have in front of us, because we hear a lot of anecdotal data. This app was fantastic, it's helped me with this, or having free access to a psychologist has been great for my child. You name it, right? But again, that's anecdotal. We've got 175,000 employees across the United States, and then you can multiply that up based on members as well. So anecdotal data is only going to get you a slice of it. One of our biggest struggles is, you can say, and we talk to our vendor partners and they say, well, your behavioral health utilization is up by 13%. And I say, that's possibly a really good thing. Here's what you're not telling me. Is this quality care? Are these people getting care in the right setting? And, a lot of them will throw, well, PHQ-9 will tell us this. And it's like, okay, well, that's been around for a really long time. We all need to start thinking differently about how do you measure behavioral health quality of care? And that's a very difficult proposition, because, again, it's not a knee replacement. It's not, well, did they, were they readmitted after a knee replacement? Very measurable. When you're talking about, again, a spectrum of behavioral health conditions, someone may only need, 6 EAP sessions and their issues resolved. Someone may need ongoing interactions with a psychologist or psychiatrist. And so really challenging our partners to come up with ways, and we're still working through this, so we don't have an answer. And I think more employers are starting to ask that question and really forcing some of these providers, whether they be sort of the core behavioral health providers or some of these new entrants into the space that provide a lot of the digital capabilities. It sounds like Lisa's implemented recently, is I need a better way than self-reported data to tell me whether these programs are working. You mentioned health risk assessments, and of course we do a health risk assessment. And I can sit here right now and say, if I were to sit here and say 100% of our employees that participate in that are completely honest with you, I would be lying. And that's just the nature of it. I get it. So we've got to take it from a different angle and really analyze the data, and then connect that back to the medical data. So how can I look at people that are participating in some level of emotional well-being programs that we offer that are dealing with a medical condition? What do those outcomes look like? Because the research does tell you that. So we're starting to work through now really developing our measurement and analytics strategy to see, and look, we didn't put in a bunch of new vendors. You know, we leveraged a lot of the capabilities of the vendors that we had during the pandemic because, to your point, we were dealing with COVID. We were being asked to do jobs we've never been asked to do in the past. And as a bank, you know, we also had to support things like the Paycheck Protection Program. And so we had redeployed all these people in different parts of the business, and that's stressful enough as it is. So we're taking a step back and saying, what does our measurement strategy look like going forward from an emotional well-being space? And then how do we really measure that to determine what is the next phase of solutions that we think can be really impactful for our population?
Yeah, and thinking about longevity too, you know, you all have always done a great job. I've admired both of you for also looking at your products and programs for what isn't working. So you may have put some solutions in that you find when you do get some measurement data that just didn't have a whole lot of impact. But where do we redirect now? So, you know, looking forward, I had a very interesting discussion with friends at Harvard the other day who do research on this. And we talked about, you know, how we're now trying to, as usual, look back and measure when in almost every other area of our medical practices, we have predictive modeling to help us start looking before an event, right? In mental health, it's quite a bit harder, but there is really, really good, very interesting research out there. If you think about we have predictive models for diabetes and heart disease and MSK and all these other things. We know a lot about you. A lot of people know a lot about us, and we have ways to look at data to tell us who is most at risk. In the mental health area, this research that we're looking at today with a couple of our partners, actually, if you could imagine a predictive model that not only knows a bit about you and says, we know that someone your age, in your area, at your income, with your other medical diagnoses, is probably going to do best starting out with a digital solution. So let's try virtual care first. And then someone else stratifies at your geography, for your age, for your income, with your family dynamics. You need to see a counselor in person. That works for most people who look like you. If we had a predictive model for mental health, think about, you know, with my experience, one of the biggest issues was the right care with the right provider at the right time, right? And the right care part was a huge, huge thing for us. You know, my son was transported from the emergency room to an inpatient facility 2 hours away. I had no choice in the matter. It was the only bed available in the state of North Carolina. It wasn't the right care. It wasn't even close to being the right care for him. But that's how it works. That's how the system works today. If there was a predictive model in place where we could say a 17-year-old boy in this situation, with this family makeup, et cetera, really would do much better in IOP and at home every night in his own home, that would release so much of the stress on the system, getting people to the right care and to the patients, getting people to the right care at the right time in a quality manner, like you're talking about, Matt. So, you know, kind of thinking ahead, where are you all concentrating on what you're going to do next and how you're going to morph your strategies and programs to get to that thing that you're talking about, Matt, which is getting folks to the right care that's going to work for them? Because a lot of the mental health strategy that's in place in the United States today is throw the spaghetti up against the wall and let's see if it sticks. Let's try these 5 meds first. They don't work after a couple months, we'll try another 5 meds. Let's try inpatient care first, then maybe outpatient care, step down, step down. Those things don't work for everyone. How are you going to approach your forward-looking strategy to kind of help get in front of that particular issue? Lisa, I'll start with you.
Sure. So, I don't have the answer to solve every problem there is, Kelly, but I'll give you a couple of my thoughts. One of the problems with our previous EAP provider was it was like just, here, you get 6 visits, and Matt, you get 6 visits, and everyone gets 6 visits, but we didn't have anything in place to guarantee that our people were getting better. So, to me, it was, just like a restaurant handing out 6 visits to every single person when that's not the right thing for everyone. The vendor that we chose to go with has said that they will get our people better faster with providers that are more successful at treatment. So, I really want to see if that statement is true. One thing that I will say is that, we really see this on the leave side, that people struggle with anxiety, depression, but they didn't have a therapist. So their leaves weren't approved. And, you had people who were struggling with a mental health condition, but weren't getting any treatment for it. So, they're not going to come back to work. They're struggling, they're out of work, but they're also not receiving care. So, I really want to test this new vendor and see, will they get our team members better faster by moving away from that, 6 visits for all sort of prescription? Will they be able to help our leave incidents? So knowing that someone can get an appointment in 24 to 48 hours, and this new emotional well-being vendor can actually sign off on the disability form, this is some good news for our team members, but we need to see what impact this has, and we need to really study it in 2022 and see if it's meeting our needs. So, I don't have a great answer for you, Kelly. I think it's really just to observe and see what the impact is of this new model on emotional well-being and how it impacts our leave data to see if it really does have an impact.
Yeah, but I think that is a great strategy, because if your new vendor is able to navigate folks to the right care, the appropriate care, and I love that you're monitoring productivity as part of this, because people who are stressed and sick themselves or have a family member who are not at work. And if they are at work, they are extremely distracted. They're not productive people, nor are they happy. And so I think linking that piece to it is a great way to measure if the program is working. Matt, how are you approaching it for go forward?
Yeah, well, I mean, in the story you just spoke about, Kelly, I mean, that's one of the toughest things, is because, someone in that moment dealing, especially with a child, going through a serious mental issue, is simply going to do what they're told, right? Okay, inpatient is the way to go. Well, is it? I mean, it is the navigation piece that Lisa was talking about. And there are, as I think probably everyone attending this call knows, I mean, there are new entrants into this space, which seems like on a daily basis. And we've spoken to many of them. And a lot of the solutions on the surface seem to make sense, but I don't know holistically that they can be effective. And so we are going to have to go through, if we decide to utilize a third party, or if we decide to leverage the capabilities of our current partners, a very rigorous approach to understand how can you facilitate that navigation. So someone who's struggling themselves or has a family member that's struggling, again, across what is a very broad spectrum of emotional health, they need the guidance, so they have that insight from a professional to say, you know what, you probably just need to talk to a therapist. In some instances, maybe you just need to talk to a friend. It doesn't need to be a clinical person, or, whatever that may be, or God forbid, you're going to your primary care physician and then they're acting as a behavioral health professional and writing you a script and saying, tell me how it goes in a month and a half. So it's really sort of crafting, and I think it's up to all of us as large employers to really drive that narrative with support from the clinical resources that we have access to, setting those parameters for, how do you help that person navigate? navigate to the appropriate provider with measurable results, which again is a struggle, in order to determine the right solution for your population. And that's one of the biggest struggles that we continue to deal with. And again, as we talk to whether it's, the traditional large providers or some of the niche providers, everyone has, I think, a different component to it that they feel like they can address very well. We still struggle with who can handle sort of the overarching issue of navigation, access, high quality providers, measurable results. Those are the four things that we're ultimately trying to solve for. And that's going to be a process. It's going to be a process that we're starting to undertake now.
Yeah, and I think from my own personal experience, I mean, I knew that these problems existed in the system before the pandemic. I've helped many employers who've called me on a Saturday and said, my daughter needs to get into a treatment program, help, I need to find something today. It was only when I was faced with it myself did I realize that someone, I was able to call my friends at, who were leaders at Optum Behavioral Health and Aetna and others, because I knew them and I had those resources. For those who just walk into a PCP office, like you said, Matt, and said, my kid is struggling, help, and the PCP just writes a prescription and says, call me back in 6 weeks. How in the world do they navigate when the worst happens? There's really not a lot of resources to help that folks are aware of. And I can say that in that situation, calling your employer is not necessarily the first place you call, right? So the whole idea of navigation in and of itself, having a navigator, an advocate for you or your child or your family member within the system that knows what they're doing, I think is key here, because the large vendors are really good at navigation when they have something on the other end as a solution, right? So as long as they, like Lisa experienced with her last vendor, you have to have a solution. You can navigate somebody to the right person, but if you have no one in the network that fills that hole, there's no sense in even having that solution, right? Lisa, were you going to say something?
No.
Okay. So kind of last but not least here, we have 10 minutes left in our session, and I did want to open it up to questions. Unfortunately, we have to use the chat box since you all can't talk to us when we can't see you. So Jen, can you open it up for questions and let me know if there's anything already in the chat box for questions?
Absolutely. I don't see anything in the chat box yet, but yes, as Kelly just mentioned, please just use the chat box to submit your questions.
Great. While those are coming in, I just wanted to take a quick moment and kind of wrap this up with a bow. So obviously, Lisa and Matt, we asked you to speak today because we knew that you were leaders in this space and that you had already kind of looked at this upside down, backwards and forwards, and had been doing it since pre-pandemic. I'd like to ask each of you if you could just tell me advice for employers who are smaller, who may not have big HR departments, which I know some of you don't, even though you're in large employer settings, may not have access to consulting partners to help them out. If you had to tell an employer, 3 things that they should start looking at today in order to A, understand what their workforce is up against, B, take action on what their workforce is up against, and then C, how to pick the right solution going forward, what advice would you give them? Lisa, I'll start with you.
So I don't recall what the 3 things that you asked were, but I would say, for me, like looking at the leaves data. So don't just look at the medical claims or the behavioral health claims, look at the leave data too, because in our leave data, we saw a high incidence of claims due to anxiety, depression. So it makes it an easier ask when it touches more than just the medical prescription drug or behavioral health claims. Second, I would say is, ask the question. So beyond just looking at the data, pulse with leaders in the business and ask how their workforce is doing and how they're interacting with their current program. So honestly, I didn't know that there was anything wrong with our behavioral health carve out until I started asking that question. And then, like the floodgates opened, and it was like, there's no providers for my child in the Chicagoland area. And then the more times you hear that, you can sort of figure out, what is the problem that you're facing. And then third, I would say, is like really normalize these conversations with your senior leaders. So don't be afraid to talk about mental health with senior leaders. I think, pretending that mental health challenges don't exist doesn't help anyone. And the more you can really normalize the conversation, address the fact that people are under huge amounts of stress and strain, both at work and at home, and it's really in all our best interest to come up with a solution. I think it helps make your argument or your decision point a little bit easier to get across the line if you really normalize that conversation. So I know I didn't hit exactly what you asked
No,
for.
that you actually did. That was exactly right. That
Off
is
the
exactly
top of my
right.
head there, Kelly.
I talk too fast too, so that doesn't help. Matt, what would your advice be going forward for employers who may not have all the whole picture?
Yeah, and I mean, look, whether you're 1,000 employees, 10,000 employees, 100,000 employees, I think there are a number of things, and Lisa hit on a couple. I think leadership involvement is a critical piece. You could have 1,000 employees, but when your head of HR, your CEO is the one delivering that message, it can have a real impact. I think especially with some small, mid-sized companies who maybe don't have the size or the budget or the staff to try to put in a bunch of carve-out solutions or point solutions, which quite frankly can be confusing to people anyway, is work with your health plan partners. One of the things that we did, and it doesn't have to be a formal clinical audit, which we do, is, we do look and we ask our vendors to come to the table and have a meeting that's solely focused on behavioral health. Talk to us about the issues that you're seeing. What does the utilization look like in our population? How are the clinical teams, whether they be off the shelf or customized, how are they integrating potential behavioral health resources as they're managing those medical cases, those acute or chronic conditions, because those connections exist. So you may not have, access to your point, the highest levels at OptumRx or at Aetna, but you can still get access to resources because they exist within all of the carriers. So there are definitely things you can do, and you can start small. It doesn't need to be, we're going to totally redesign, our behavioral health coverage or our EAP program. It can be very small steps just to really start to get the message out there. And then just tell people where the resources are. Give them that education. Try to focus on engagement. I love Lisa's idea of, making the stories real, because I think employees react to other employees. Then the last thing I'd mention is there is so much research that has been going on and continues to go on that we all have access to. This is publicly available data. So get yourself educated on what's happening in academia. There's so much great information that can lead to ideas that I think any size employer could potentially implement for little to no cost, just working with the various internal resources.
Yeah, that's a really good point. I think sometimes employers think that they have to look for point solutions. And you're right, there are many, even, basic medical plans, even TPAs that do offer resources. You just have to ask what's out there and what's available. And sometimes they're built into their programs. So there's not necessarily a cost implication. I liked both your points. There's a real simple one that's free, and that is be able to talk about this, right? If we reduce and eliminate stigma from the top down in an organization, that is a free step that you all can take as employers to at least open the conversation. I think when Nikki was presenting our research, I hope one of the things that came through loud and clear was there are many people out there who still have not or cannot or won't raise their hand and say, I need help. Those with unmet needs are great. And so I think it's up to everyone as an employer to seek out and find those people, or at least make it okay for them to come forward and say they need that help and those resources. That's a free step that every employer can take, right? So we don't have any other questions from the audience. I want to thank you both, Matt and Lisa, for your time today. As usual, it was a great conversation. For those who are dialed in, again, we apologize for the lack of video, but we will send out to all registrants both the deck and the recorded webinar for today. So if you want to actually watch it, you may. And then thanks again for attending an IBI event. We continue to do research for this very reason, because we think that there's a need in the industry, and we will continue to do so. We hope you join us again when we're not having technical difficulties. All right, guys, thank you so much. Have a great day.
Thank you all very much.
Thank
Appreciate it.
you. Bye.